Good day to all of you. It is a pleasure to be here. My name is Adolfo Ginás. I'm the medical director for Fundación Santa Fe de Bogotá in Bogotá, Colombia. I would like to start by thanking ISQA and the International Hospital Federation for the privilege of sharing this space with you. I would like to start by sharing with you some context, which I think is relevant to our conversation, and then provide a few examples of what we have done to care for our people during this pandemic. Fundación Santa Fe de Bogotá is a private, not-for-profit foundation where we strive to contribute to health improvement through patient care, research, education, and actions in population health. We typically see about 100,000 people in our emergency room a year. We perform about 250,000 images, about 1.5 million laboratories, both inpatient and outpatient, about 17,000 surgeries, and about 30,000 procedures. We have a construction of about 75,000 square meters, and originally 320 beds, which we expanded to 500 spaces for patients during the peak of our pandemic. And we used to have 37 intensive care unit beds, which we expanded to 140 intensive care unit beds. We are a university hospital, and we see undergraduate students, residents, and fellow in a typical structure of an international hospital. Colombia has about 50 million people, and we've seen more than 2 million cases of COVID, of which 57,000 have died. We have about a 2.6% fatality rate and about 114 per 100,000 deaths at a national level. Now, when we were bracing for the pandemic, the key question was, what configuration should we adopt to honor our value proposition? And very specifically, what would be the phenotypic expression of our culture when we were faced with the challenge? Now, I would like to highlight that we did have time to prepare in looking at what happened in Europe and in North America, and that really gave us a head start. So there was a corporate decision to create 6 pillars to address this huge challenge. And a very strong message that was there from the beginning was that pillar number 1 was prioritizing the protection of our staff. And this very simple action, but very profound in terms of commitment, had a huge impact on the way we actually responded to the crisis. I will mention to you 15 interventions very briefly that I think would enrich our discussion later on during your session. We first safeguarded the safety processes from the point of view of quality improvement, and specifically stockpiled in personal protection equipment. So there was a very clear message from the start that our people would be protected to the international standard. We prioritized recruitment of human talent, incorporating more than 300 people to our organization. We strengthened our educational capacity in terms of our ability to induct these new workers to our institution without challenging our safety protocols and guidelines. We created an enormous emotional screening program. We have a culture of a liaison mental health department who took charge and created, for example, a hotline and free access to mental health support. We created a daily screening process where each worker or staff member would receive an email with a special scale that you had the opportunity to fill, and it was a very subtle way of communicating need for help. And the scale was designed actually to sort of detect changes in the behavior of individuals or microclimates where problems were arising. We were prepared and actually individualized needs and interventions in a very diligent manner. We made a commitment not to fire anybody, so there was no loss of employment with the economic challenges that this requires for our organization. We provided economical support for those who were more vulnerable and allowed home office, which is not typical for our culture. We created a free transportation program in alliance with the car rentals and many of the car dealers in Bogota, and then provided some very creative solutions in terms of safe transportation. We modified the cafeteria routines to accommodate the schedules for those who were caring for extended calls in the wards, and created hydration stations in the COVID wards and ICUs. We enabled transitory housing within the hospital initially, and later in hotels with whom we had agreements to actually do this, preventing people who were at risk of contaminating family members if they went home during periods of suspicion. We removed students, interns, and residents and fellows from direct exposure to patients, and created two massive programs of real-time information for nurses and for the medical staff. I would like to thank you for listening to my presentation and look forward to the interaction during the discussion.
Thank you for having me and giving this small lecture on employee well-being during the COVID crisis. When we were confronted with what was happening in the northern part of Italy, we had a single strategic point at the horizon. We don't want this to happen in our hospital, where people would be lying in corridors being ventilated, a lot of casualties, and the army taking away the corpses at night from the hospital. So it was very clear from the beginning, for the whole hospital, we did not want this to happen. So overnight, we switched from the governance of a complex adaptive system, which is a hospital, into a single purpose-driven organization. Our baseline was the one from the WHO. Perfection is the enemy of the good. So you don't have to wait, you don't have to discuss a long time, you have to decide quickly, swiftly. And if you will make mistakes, which you will do then, that's not a problem. You can always correct them. Speed trumps perfection. The worst thing you can do in a crisis is do nothing and continue debating. So this is the baseline we followed. And the rules of thumb in crisis management are very simple. You need a unity of command, unity of execution, and a unity of communication. So within the hospital, overnight, we switched from a very complex hierarchical organization with 41 medical departments and 16 non-medical departments into an extended executive committee, which was the crisis cell with power of attorney, and 5 working groups within the hospital to reshuffle the organization of the institution. The third working group was HR. Because there's 4,400 people here, half of which would have to change their working environment to get out of their comfort zone. We had 1,200 volunteers. We had to streamline the flows. The government issued special attestations, and we had to take care of this. So HR was a very important working group. Moreover, we knew that what was coming at us was, the typical first wave of immediate COVID patients, then the second green wave of postponed non-COVID care, the third purple wave of the impact of COVID on chronic conditions, and then the very important fourth wave, which shows the emotional and psychic impact of this pandemia, not only on society in general with psychic trauma and burnout, etc., but also on the working force of the hospital. So very early on, we issued a program which was called Personnel Delight, where we defined more than 100 actions in order to support the personnel to show them signs of respect and appreciation, and also to make life as comfortable as possible for them. And I will give you two examples where we two of those 100 actions that we did and where we measured the effects. The first one is maybe a bit peculiar, is the importance of art and culture. Now, in this hospital, we have a tradition of trying to build what we call a healing environment. And there is scientific proof of the positive impact of confrontation with cultural events and arts on the length of stay, for instance, of patients. So, for instance, when we had our first nurses being vaccinated 3 weeks ago, and this was an ICU nurse, we give every collaborator a piece of art of a very famous Belgian artist, which is Casper Bosmans, and it's a numbered lithography. And so, as a sign of appreciation for the workforce, we try to thank them by giving them a prestigious piece of art. We also made a photo book by a famous Belgian art photographer, Lieve Blankart, where we made a special edition. And on the 6th of March, we will have the first anniversary of the first COVID patients coming in the hospital, and every collaborator will receive a personal copy of this photo book. Another famous Belgian artist is Casper de Vos, a very young artist who made a very impressive piece of art, which is called The Helping Hand, and which will be installed at the front, the front entrance of the hospital. It's a bit dark here, but these are people of our own hospital, collaborators who are very artistic and who made a documentary film and gave their musical impression of what happened here during the COVID crisis. And finally, the Royal Theatre in Brussels is closed during COVID, and the artists were very thankful of what we did as a hospital for them. And so we organized flash mobs in the restaurant of the personnel, for instance, here. A second example is Villa Resilience. For your information, we have a charity-built Villa Samson, which is a house where people children and adults can meet their pets, their own pets, or also animals which are available for pet therapy, also in palliative care situations, etc. It's a big success, but during COVID, these contacts were not allowed, so we changed Villa Samson into Villa Resilience, which is actually a free walk-in support for use at Brussels staff, where they could meet a team of psychologists and trauma experts. Very low threshold entrance, free during working hours. People could go there and talk and relax and meditate, etc., and be supported by professional staff. And so we measured the effects of this on the well-being. Now this is in Dutch, but showing you that half of the people, of the personnel who went there were nurses and doctors, and the majority were nursing personnel with symptoms of anxiety, tension, overwhelmed by the situation, tired, sad, etc. And then after the sessions, which could take from 15 minutes to 3 hours, they were more relaxed, more relieved and happy, and they really experienced a very positive impact of this action. And so to give you a proxy of during the first wave, we just started doing and developing all this, and we had a sick leave which was superior to what we normally see during winter time and springtime, as was in the first wave. And then during the second wave, which hit us actually much more importantly with a higher peak and a longer duration of patients admitted to the hospital, we saw the effect of all these measurements that we have taken, and we saw a decrease in sick leave, actually lower than the normal winter average, which was very surprising for us, because this was proof that all these actions really had a positive impact on the resilience of our personnel. And I think the key message here is that we allowed personnel to search for and find their own ikigai, and the intersection of what you love to do, what you're paid for to do, what you're good at, and what is necessary for the purpose we had defined as our hospital. So if you can find this and really endorse and support your personnel in finding this and helping them through the way and showing appreciation and respect for what they are doing, then the result that you see is the lowering of the sick leave. And this is just two examples of the many actions that we took, and hopefully they can inspire some of our colleagues. Thank you very much for your attention.
Hello, ladies and gentlemen. It's a pleasure to meet you all on this platform because of COVID pandemic. The pandemic brought us a new day and night, and this is one of the day for some of us, like attending Zoom conference online, which make it somehow easy to attend. And this can be a night for some others. And once again, hello everyone. This is Noha Obshet from Ethiopia, Africa. I'm a counseling psychologist and coordinator of mental health and psychosocial support for the COVID response at the Ethiopian Ministry of Health. Unlike other countries, most of our senior and new graduate healthcare providers and support staffs are being engaged in the preparedness, response, and control of the novel coronavirus since April 2020 here in Ethiopia. Months later, after the outbreak, as a ministry, we had established MHPSS Advisory Council and MHPSS Task Force. The task force aimed at providing MHPSS service for people with coronavirus and MHPSS service for healthcare first responders. Today, I would like to present MHPSS services that we have provided for the healthcare providers. And I know the most differs have their own drawbacks, and we are hoping that things will be better if we continue working harder than we did before. Saying this, I suppose you are looking forward to hear our major three solutions for the well-being of our first responders. The solutions are staff integrated therapy, mobile therapy booth or mobile therapy stand, and the last one is line-based counseling, which combine both hotline and text line counseling service. Let me share you my screen. Coming to the first innovative solution, it is an integrated staff therapy, like of making change to the therapy rooms or counseling settings, so as to make it more nice looking. Not only therapy rooms, but also the hospital environments. And some hospitals, as part of the staff therapy, they had reduced working hour 6 hours a day. The integrated staff therapy includes one-to-one therapy, group counseling, consecutive emotional resilience trainings, physical exercise, and yoga programs. Such solutions help health care providers to be aware of their stressors, and at the same time, it supports them to overcome those stressors. The best thing we had here is a niche intervention. Both medical staffs and supportive staffs have taken a part and got the service without any restriction. When I say restriction to the support staffs. Besides, as you can look on the screen, we made change in the therapy rooms. They work in a very tough working environment, and considering this, we tried to establish a mini library as a form of refreshment, and we had decorating rooms with paintings. The second innovative solution is admitting staffs separately when they are infected with coronavirus, and setting up mobile therapy booths. The mobile stand or the mobile booth is invented by Dr. Aida and her team to help staffs communicate with their families and counselors also. The stand is designed in consideration of COVID infection prevention and control standards. As you can see here, there is a transparent glass between the patient and the counselor or his or her family. In general, the separate area is very therapeutic, and it is a healing environment by itself. And the mobile booth helps not only staffs but also other patients too, to communicate their families and to talk with their medical staffs. If we replicate such mobile therapy booths, I hope it will be helpful. One, because it is mobile or easily movable, and because it is innovation at the age of COVID pandemic. This booth is better than treating people in full cover gown, which make first responders one of the Spartacus warriors, and which sometimes break the rapport building or which make it difficult. The third solution is major. It is a major solution, and it is launching of line-based support for our healthcare providers. Counseling services had, in the case of face-to-face or in-person therapy, due to lack of awareness. If someone requests for the service, he or she is going to be labeled as mentally ill or who have a severe psychological social problem. To mitigate this, we have established line-based supports side to the awareness creation. Our text line service hides client's identity, and it simply use code names. Majorly, this service helps medical teams, those who are working in the ICU rooms. So these are the major three solutions that we have practiced for the last few months or at the age of COVID pandemic in our hospital settings. Thank you very much for listening to me. I'm Seknalo in Amharic.
I bring greetings from the Christian Medical College, Vellore, and the consortium of accredited healthcare organizations in India. The Christian Medical College, Vellore, was established by Dr. Ida Sophia Scudder in 1900. Today, we have over 3,000 beds, managing about 9,250 outpatients, and we have about 10,500 staff employed. During the peak of the pandemic, we have deployed about 983 beds for COVID management that included 110 ICU beds. We have treated about 10,452 COVID patients so far, and the number of staff deployed in the COVID wards is about 2,100. We're extremely thankful and happy that we have not had any staff mortality. When the pandemic began in India, it had a great impact on the healthcare workers, particularly because of the stigma. A very senior neurosurgeon who died of COVID-19 in March, and Dr. Silo, who served for decades in Meghalaya, couldn't find a final resting place because of the stigma and the community. The government sprung into action and passed the ordinance. Up to 7 years in jail for attacking COVID warriors. They did what they should be doing. But the healthcare leadership realized the impact. They really realized that it was important for them to exhibit good leadership and stand with the healthcare workers to make sure that they are taken care and they are supported, particularly their well-being. I'm able to relate with this article by Wu et al. About the principles of good leadership during COVID-19. I witnessed this not just in my hospital, but across hospitals in India, the excellent leadership that was exhibited by healthcare leaders. Particularly, I like this line where it says leaders and managers need to be empathic, compassionate, and understanding. They also need to be aware of their employees' personal circumstances and that they may change rapidly. In my hospital, we sprung into action way back in March. We realized that it was extremely important to plan and get ourselves prepared for what was coming. So, particularly important that our human resource team was well established to take care of manpower planning, staff welfare, training, upskilling, and also the staff health. It was a central HR team, and it was very clearly decided that all departments were going to be deputed for COVID management, all clinical departments. And it was important to upskill all the doctors, nurses to take care of the COVID patients. The deployment was based on levels of care that was needed and also the skill set. The senior leaders were available everywhere. They were involved in supervision, contact tracing, counseling, and also decision making. We realized that it was extremely important to make sure that we take care of their safety to build their confidence. They were scared in the beginning. They were scared about everything, whether they would get it, they would pass it on to their family. So we had to provide them with appropriate PPE. I'm extremely thankful that we did not run out of PPE at all, and our supply chain was so strong that we had adequate and appropriate PPE available throughout the pandemic. We created shower areas, temporary shower areas, provided our staff with scrub suits, made sure that all of them took shower before they went home, provided shampoos, towels, food, and we even reduced the work hours to 6 hours in the COVID floor so that they are comfortable working with the personal protective equipment. Adequate leave was provided to all of them. Engineering controls were set up in place. The hospital was divided, not just the wards, but every area as a red zone for COVID positive, orange zone as COVID suspect, and green zone for COVID negative and clean areas. Negative pressure areas were created, exhaust fans were put up in different areas, all this to boost the confidence of the healthcare workers working in these areas. We realized that communication was the key, and we had to update information on a day-to-day basis to all the healthcare workers, because it was a lot of information getting passing disseminated through WhatsApp and all other social media, and people were getting scared. So we had to provide valid and scientific information. So every week our leadership met up with the staff through online platform, through Zoom, and made sure that appropriate information was provided to them. Physical upskilling programs were conducted, online classes were conducted, resources were made available in intranet in all languages for our staff to read and understand at all times. 24/7 call centers were set up to address all their queries. This was extremely important, and I really liked the way our community took care as like a gated community model to take care of all our staff. Transport facility, particularly because our country went into complete lockdown, we had to ensure that our staff were supported with transport facility. Staff encouragement teams were set up to talk to staff in COVID areas and to motivate them on a day-to-day basis. They even understood the staff who were depressed, doctors who had issues, nurses who had issues, and slowly weaned them off from the COVID areas, supported them through counseling and support. Neighborhood watch teams were set up to engage with the community in our campuses to support staff and their families. We have had instances when the parents were admitted and the children were COVID positive and the children were at home. So we admitted them in COVID negative areas, took care of their food, their support, and ensured that the parents were comfortable. We even took care of the elderly parents and ensured that the entire family was like a buddy system, ensured that others were there to support the family. WhatsApp video calls with frontline workers were made by senior faculty to hear them on a day-to-day basis. Meetings were arranged by to support our support departments like CSSB, laundry, to allay their fear. They had a lot of questions, so the senior leadership was present to talk to them in the local language and to make sure that they were comfortable. Extraordinary leave was provided to many staff. Lean on Me, the online counseling service, was provided to all the workers. Medical care was provided 100% free of cost, not just for the staff but for the families and the extended families as well. Hostels were converted to quarantine facility to ensure that it was available for people who could not travel, and also as quarantine facility so that the family felt supported. Food provisions were available in plenty for the staff working in the hospital. We listened to the voice of the staff working in COVID areas. We publicized this to make sure that this was heard and others were motivated and others felt and also the COVID warriors and staff felt happy that they were heard. This was published in our weekly news and circulated very widely. We listened to our patients. We talked to them on a day-to-day basis, got the feedback from them and passed this to the COVID floor so that they were happy that their care is being appreciated. We listened to the staff working in COVID areas. We took feedback from them on a regular basis. It was heartening to see for the question on do you feel that you're taken care by the institution, 93% of them responded that they were comfortable. Hospitals in India, not just these aspects, they embarked on many aspects to support their healthcare workers. Karuna Hut for employee health, psychological support, yoga. Many hospitals had yoga sessions for their staff to de-stress them, stress management sessions with psychologists, psychological support provided to them, yoga at home through mobile apps, buddy systems, partners to support each other, appreciation certificates for the staff who are working in COVID areas. We did what we can do best. Everybody got together, the healthcare leadership got together and supported the healthcare workers. And I think it's extremely important as healthcare leaders that we innovate and find measures and ensure that our staff are heard. This presentation I dedicate to the strength, resilience, and well being of frontline workers across the globe. Thank you for this opportunity.
Hello, I'm Mary Nash, Vice President for Organization Development and Learning at NYU Langone Health in New York. Really delighted to participate as a member of this panel today with a focus on critically important topic, well-being. I'm going to focus a little bit on communication and how that supports well-being, along with an emphasis on expressing gratitude. So prior to 2020, many of us were familiar with the term VUCA, and many of us thought we not only understood it, but had experienced it. And 2020 showed us what VUCA was if we didn't know before, and if we'd not heard of the term before, we know it now. So VUCA, emphasizing the volatility, the uncertainty, the complexity, and the ambiguity of the situation that we have all been for the last year. Some at different times, and for many of us still very much in this space. And through our communication efforts, we are striving to address this concept of VUCA and try to ameliorate each of these 4 areas. So for example, with the volatility, focusing on finding the calm. How can we provide more respite rooms? How can we help demonstrate the importance of mindfulness and finding time and space to take a breath, do breathing exercises, things like that. The uncertainty, focusing on gathering all the data we can. We're a very data-informed organization. We have scientists and researchers and physicians and others working all the time to find answers and gather that data. Then the complexity, how do you attack this such a large, complex, complicated problem? And so breaking it into chunks and finding those small wins, recognizing the small victories and the milestones along the way. And then the ambiguity, how do we find our way? You know, the trial and learning, focusing on learning from things that maybe don't go perfectly or correctly the first time, but, you know, keeping trying, keeping learning, and then communicating to the point of what feels like over communication. But one thing we've learned over this last year is there really is no such thing as over communication. No matter how many ways or times we got information out there, there's no such thing as too much information, and also no such thing as not providing enough ways for that communication to come back. So the two-way, making sure that it's dialogue and not just passing information. So the photo that you see on the right-hand side of the screen is the cover of a magazine we put out this fall, really celebrating all of the work, the hard work that everyone's been doing across the organization. And so communicating that gratitude and appreciation, recognition for the hard work that everyone's been focused on. And as this spread from that magazine emphasizes, that relationships and people caring about each other are what are at the root of resilience and supporting our well-being efforts. This is, in addition to the magazine, one of the other ways we've demonstrated or supported well-being through communication is on our Inside Health page, which is our intranet. And this highlights a suite of resources we've put together called We Care. We Care being an acronym as well for well-being, empathy, compassion, authenticity, resilience, and excellence. And we have e-learnings, we have tip sheets, we have many resources for people to be able to seek support and support their well-being, support their resilience throughout this. Our colleague appreciation page is another venue for communication. Again, encouraging dialogue and two-way communication, not just putting information out there, but getting information back. And you'll see here at the right, there's an opportunity for people on the front lines, so to speak, to share their experience. They can write about their experience, they can share photos, and then thanking our frontline heroes, thanking those who are working so hard. We've got the opportunity to post thank you notes, photos, things like that. And also on that page it's a one-stop shop. It's one place to go to be able to find all of the different resources we have available for our employees to support their well-being, support their resilience. Also, you'll see information for people to be able to apply for the relief fund or to be able to donate to the relief fund. So depending on each employee's situation, some have been certainly impacted much more heavily than others. And so we are finding ways to provide resources and support every way that we can. We also had several thousand of our employees reassigned during this time to serve our patients and our fellow colleagues wherever they were most needed. And expressing gratitude has been very important to these folks as well. On the right-hand side, you'll see a button that was distributed to the physicians who worked in areas different than their normal locations. We considered them our COVID army, and see a little snippet of the thank you note that they were provided. Absolutely forever grateful to all of our employees for the amazing work that everyone's put in over the past year. Our Dean and CEO, Dr. Bob Grossman, did a wonderful video around Thanksgiving, around American Thanksgiving time, expressing gratitude, and again, using many photos and short video clips, emphasizing and highlighting the work of so many of our employees across the system throughout this time. And along with all of the internal communication efforts, the opportunity to partner with media external to the organization and get so many of our stories out to the broader world has been really important as well. I encourage you to, if you're not already, partner with your local media and do what you can. It really means a lot to the employees to have those outside, both inside and outside the organization, to express the gratitude, the appreciation, the recognition. We have a question that we ask regularly of our employees. NYU Langone Health cares about my health and well-being, and this has been important to us for a long time. We've known in healthcare that this has been a very important issue for a long time. And we last asked this question in the fall of 2019, just a couple of months prior to our major surge. And we asked it again a year later, which was October of 2020, after our surge, but still well in the midst of the pandemic. And we really didn't know what to expect. And we were really gratified to find that actually our efforts have been paying off. We have a long way to go. This is not, our overall score for well-being is not where we want it to be yet, but just knowing that even through this really challenging year that we've had, that we have been able to make a difference. And we want to learn from this, continue to learn from our employees, find out what's working well, find out what else would be helpful in addition. But that is one indicator for us that we are beginning to make some improvements in an area that's just of critical importance for us. So wonderful to be here and learn from all of our colleagues from around the world. So thank you for this opportunity. Look forward to discussing more.
Dear ladies and gentlemen, it's a great honor to share with you our experience on advocating occupational safety in China. Let me start by telling you that the University of Hong Kong Shenzhen Hospital was established with the special purpose of stimulating hospital reforms in China. We are only 8 years old, and in this 2,000-bed hospital, we have over 3,000 staffs. We are the only hospital in China that has obtained accreditation by both the ACHS and the National Class 3A systems. They are standards set by ACHS that are not required by the Class 3A system. Occupational safety and health management is one of them. Hence, we introduced a well-structured OSH management system as part of the hospital reform. For traditional local hospital, they mainly take care of shock injury and radiation safety, but we advocate comprehensive coverage of all risks. Staff management, training, and promotion of OSH by various media is a fundamental step. We regularly do risk assessment and implement the essential safety measures. Happy to say that thus far we have no incidents related to radiation, chemical, or laser injury. Another important aspect is biosafety, especially during the COVID-19 pandemic. We have admitted 470 suspected cases and performed nearly 560,000 PCR tests. Again, happy to say that with all the meticulous measures implemented, none of our staffs or patients has acquired infections during this period. Indeed, I've even published in our oncology journal about our experience in maintaining good quality cancer treatment during this difficult time. We started detailed analysis of the different types of injury on duty 4 years ago. As expected, shock injury is the commonest. But unlike other countries, workplace violence here is our second commonest. We hence focused our efforts on these two types. Our data show that the highest risk area for shock injury is the operation theater. With CQI program initiated by staffs to improve the preparation for each case, improving our staff knowledge and compliance, the rate is substantially reduced. This is the overall rate for the whole hospital, with the decreasing trend, especially in the recent years. In China, there have been tragic stories of angry patients hurting doctors when the clinical outcome is below the expectation. We have been trying to build better doctor-patient relationship. We preach good medical practice. We tell patients about their rights, but we also request them to honor their responsibilities. In case of medical error, we will openly disclose and pay the corresponding compensation by insurance. But we insist on zero tolerance to violence, and will immediately report to police if there are such disturbing cases. With all the efforts, together with the support by the government, the number of incidents has decreased by half during these 4 years. So the pattern of ILD has changed, and injury due to fall is now our second commonest, and hence CQI is ongoing to reduce the incidence. In addition, efforts are being made to further improve training and facilities for manual handling. Overall, our total injury on duty rate showed a gratifying continuous reducing trend. All these are hard-earned results attributed by concerted efforts by all staff. We've been sharing our experience at national conferences and through publications. We're now helping the Shenzhen government to draft a standard on occupational safety. Staff is our greatest asset. Their well-being will always be our top priority. Thank you very much for your attention.